Today, healthcare is seen as something that's not a jewel necessarily, and so you have to deal with the bureaucracy and the fragmentation. But in the future, what we'd like to see is that it's seen as something that people are proud of in their community, and that the clinically integrated network takes the past and turns it into a positive experience, something that is there not to deal with just sick care, but to actually address the overall health of the community. Not only are we responding to change in healthcare, we are actually changing healthcare in some of the markets that are resistant to some of the changes. And so we are challenging the status quo. And if you think about our legacy, our sisters went to where there was need. They went into uncomfortable situations. And so we are, in a sense, kind of reliving our legacy of 125 years ago. And what is the needs of the community? How do we make the community much healthier? And that will mean we have to transform, and we need to challenge the current state. The components of a clinically integrated network are everyone from the traditional hospitals, the physicians, but pharmacies, nursing homes, home care agencies, social agencies. Anyone that touches a patient through their travels through the continuum of an experience of healthcare is involved in a clinically integrated network. Virtually every market within CHI either has a functioning clinically integrated network or is in the process of developing a clinically integrated network. Providers want to be engaged. They want to be architects. They want to help build the future. And what we find is that they are very much ingrained in the success of the clinically integrated network rather than seeing it as something that's being forced upon them. The future of healthcare will be determined by consumers. Our healthcare should be just as available on our smartphone as our banking, as everything else. We are looking at the future, and I am now the keeper of my healthcare information, and I will seek a network of providers that meets my needs. CHI will be that provider.